Hello, everyone. How are you doing today? I hope your day's been going great. And we are still on this celebration, my Mental Health Matters Facebook group at 6 months. That's a big deal. And we've chosen to celebrate this by keep increasing awareness about mental health and destigmatizing everything that has to do with mental health or any mental illness. Okay. And today we are talking about a very, very important topic. Very, very important one. And mind you, this is just not about old people or elderly people. This is information that we all need. We're talking about dementia today. And it's not just that. I have the best of the best, the experts of the experts when it comes to memory care and any mental health issue or illness with elderly people. I have here with me Dr. Maza Fawad. He is a psychiatrist with over 20, almost 30 years experience, okay? And I mean, there's just no better person I can think of to talk about this topic with us. So please join me in welcoming Dr. Kawaja. Welcome here, sir.
Thank you very much. Good to be here.
Thank you, sir. So, without wasting any more time, I want us to go into this topic, dementia.
Mhm.
And I will just start by asking, sir, what is dementia?
Excellent. Well, thank you very much for giving the opportunity. Dementia now is changed to a different word. It's now called major neurodegenerative disease. But let's stay with dementia because that's what everybody knows. So the word
Okay.
dementia is dementia, which means you are losing the mentation. So it's very easy to conceptualize. So think about when a child is born. When a child is born, the child has no executive functioning. The child has not much of memory. The child doesn't have much of motor coordination, and the child does not have much of language. Other people, parents, do all those for the children. The child then develops and slowly gains all those neuronal activities. So
Mhm.
start to walk, start to chew, start to coordinate, start to think, and as the child grows, it starts more higher functions like calculations, memory starts to develop, language starts to develop, and those things continue to develop. Then executive functioning, decision making, future planning, all those things continue to develop. So think about this child that I just described in the 20s, 30s, 40s, 50s. This is gaining mentation. Dementation or dementia is losing it. So just the opposite. So in this disease, which happens mostly in old age, can happen in early age also. When this disease starts to happen, you start to lose all those things that the brain has developed over those years. And it slowly becomes like a child's brain. The body is still old and big. So, what does it mean? Well, most cases, the first thing that starts to go away is the memory. There's a part of the brain called hippocampus that holds new memories, and cerebellum holds lots of other old memories. So the hippocampus starts to weaken. These people will have difficulty remembering, mostly things that just happened today or last week rather than those things that happened years ago.
Mhm.
So the memory starts to go away as if new memory is not being formed, new information doesn't get registered. As the disease progresses, other important brain functions, mental functions started to fade away also.
Mm.
So executive functioning cannot make future planning, calculations, words. When they see something, they can understand what it looks like, but they don't come up with the word. What is it called?
Okay.
Okay. Now, then the disease continues to progress to the point where they start to movement of the body, and coordination is also coming from the brain.
Hmm.
So that starts to fade away also. Language, again, language is coming from the brain. That's how the child learns to speak.
Mm-hmm.
And then in dementia, the speech
The
tends to
opposite.
slowly fade away,
Hmm.
to the point where I have patients who, when given food, when the nurse puts the food in the mouth, they do not really know that they are supposed to chew and swallow. Think
Right.
about a child who's like a month old. They may still have the sucking reflex,
Like, uh-huh.
but if I gave a piece of apple, then your brain calculates that it has to go in such an area of the mouth where there is better bite so that it can chew. Well,
Mm-hmm.
that capacity is going away in dementia. So if you were to make a graph, the child is born, it develops all the mental faculties,
Mm-hmm.
and the opposite is dementia when you start to lose the mental faculties. Um, I want to make a very important point here that comes so often. When
Okay.
I talk to people who I suspect are developing this disease of dementia, and
Mm-hmm.
to the families, I do talk about memory as a most common symptom of the disease. And at that point, most often I meet a resistance that I want to point out.
Is it from the person or family?
Both.
Okay.
So they think that the memory is good because this person who is now my patient, I'm talking about, can
Mhm.
remember things that happened years ago.
Okay.
And so their focus is, well, her memory is great. You can ask her what happened 40 years ago. So therefore, they neglect, they don't think that what she can't remember, things that happened recently, like what had she had for lunch or supper last night or what happened last week, their criteria of good memory is what happened years ago.
Mm, right.
I want to point that out, that dementia starts from losing the memory, that recent memory, short term, what happened just recently. So don't get fooled by the fact that somebody can remember things from way past. We focus on what happened recently, what kind of recall, what kind of memory these people have that is starting to fade away from recent.
Right.
Another important point is that many people justify this cognitive loss because of the age. Grandma's 80 years old, what do you expect? So, aging is, even though a risk factor for dementia,
Right.
aging does not necessarily does not lead to the disease of dementia. So, yes, we do see some memory or cognitive difficulty with aging, but it doesn't conform to the whole disease of dementia. So an aging person might take more time to recall, but the recall will happen. A dementia patient will not be able to recall because the new information was never registered.
Right.
Okay, so they did not make the first imprint in the brain.
Mm,
You will also see that people who have started to develop dementia will make strange changes. For example, they will put the keys in the refrigerator. And this is just an example. So, yes, many people may not remember where the key was, but people will trace back and they will recall where I was yesterday, where did I eat, and then therefore figure out where the keys could possibly be. In this disease, that process does not tend to happen. Also, many people tend to get secondary symptoms at the start of dementia. So, for example, depression. So, my another point that I want to make to people is when your parents or grandparents start to show changes in their mood, um, like if you are suspecting depression, don't think that is just a normal aging process. It can be an independent disease that needs to be looked into, or it can also be the start of dementia because it can actually look like it's depression. Um, so now think about the burden on the caretaker. Taking care of a demented patient who's a full-grown adult or elderly body is very, very difficult. Changing diapers, cleaning, feeding, preventing falls. The best advice for people who are in their younger ages and have parents and grandparents, if you want to make your life better, do something about their possible dementia, because if that person you're taking care of gets demented, you will be paying for the caregiver burden, because that's what it will require. These people won't be able to do anything for themselves. So many times people talk about Alzheimer's and dementia, and of course, the question is, what's the difference? And Alzheimer's is the most common cause of dementia. Dementia can be from many other causes. So Alzheimer's is one cause. 65% of all dementias are Alzheimer's. That's why people use it interchangeably. But dementia or major neurocognitive degenerative disease is an umbrella of diseases, and there are many causes. So Alzheimer's is one. Strokes, or what we call vascular dementia, is another.
Mhm.
Lewy body, or people who have Parkinson's type syndrome symptoms, develop dementia. That is third type of dementia. You can get dementia from HIV, Huntington's disease, Parkinson's disease, and alcohol abuse. Some drugs can cause permanent cognitive deficits. Head injuries can do it. So, just to clarify, all dementias are not Alzheimer's. It is one of the kinds or types of dementia, but it is the most common, and therefore people use it indefinitely, interchangeably. Sometimes we get patients who doesn't fit in one criteria. It can be multifocal. So somebody who has had strokes and also developing signs of Alzheimer's type, those could be multifactorial dementias.
Okay. Okay. Good. So I mean, I want you to expand a little bit on that depression and dementia, because I know it's one of the things that you were you really make sure that we do in our practice as my supervisor, that we need to we have to rule out depression first before we go ahead,
Yes.
and sometimes we actually hold on to get that over before we do a screening again to check. Can you explain to people more when you talk about changes in the parents' mood, and why they need to do something to rule out dementia?
Right. So depression as an independent process is common in elderly people. Okay, it's not just a young person's disease. A syndrome of depression will include many things: sadness, um, not enjoying things that the person used to enjoy. We call it anhedonia. Uh, Up or down of sleep, either sleeping too much or cannot sleep. Up or down of appetite, either losing appetite or actually eating more than before. Social withdrawal, don't want to mix with anybody, leave me alone kind of attitude. Loss of energy and motivation, and pessimistic thoughts. The person will be more thinking about what could go wrong rather than what could go right. Combine all those, you will see a difference in the patient's facial expressions, body language, all of those. And the reason it is important to rule out before you jump to the diagnosis of dementia is that when you are depressed, you have cognitive fogging. Your brain is not sharp because all of us have had bad days that you can't think straight. because you're worried about something, you are sad, you're not as sharp. So dementia is a permanent diagnosis. We don't want to make that diagnosis before we rule out what is treatable and is not permanent, and which can look like dementia. And that depression is one of those. Another important point right here, Dio, is that there are other parts of the body, if not functioning, can look like or even contribute to the symptoms of depression and cognitive deficits. So, for example, hypothyroidism. If thyroid is not functioning, you can have a similar syndrome like depression, but it is not the depression that we think about in a psychiatric terms. It is from hypothyroidism. It can also be from, the cognitive deficits can also be from just hypofunctioning of the thyroid. Um, Rule it out before you make the diagnosis of dementia, because once you make the diagnosis of dementia, understand it's permanent, prepare the family for the progression of dementia, because even with the treatment, it generally progresses, and the treatment is totally different. So
Okay.
make sure that you have taken care of those. Another thing that I want to mention here is that a lot of people, at least in the United States, have sleep disorders. So, for example, sleep apnea. And then when you have that, you may be able to sail it through in your younger years when you are 30 and 40. But the same person who is now 75 years old, the sleep disorder, which basically means your brain is not getting energy. Sleep is where you reform your damaged neurons and body parts. Um, will have more impact in elderly patients. So sleep is another important thing that one has to rule out. A lot of elderly take a lot of medications, at least here in the United States. So
Yeah.
there is a lot of side effects that can contribute to mental fogging. One has to rule those out also. So one of the most important ones is what we call anticholinergic medications. Many medicines that people take for different reasons, heart reasons, etc., start to make that anticholinergic burden. I call it burden. And yes, when you are
Can you give us
25,
examples of those anticholinergic medications so people are just have, in case anybody is taking it, they can have that at the back of their mind.
right, right. And the physicians usually are pretty good at assessing it. The point I want to make is that a younger brain may be able to handle the same amount of anticholinergic medicines, but the same brain when, 75, 80 years old, it is an impactful feature, and then becomes it looks like cognitive fogging. So
Okay.
the point is that yes, we have to be cognitively aware of the diagnosis of dementia, but before you go to that conclusion, rule out other things that could look like cognitive deficits from dementia.
Right, right. Okay, thank you. So, Dr. Kawaja, can dementia be prevented at, or, other than the ones that has to do with maybe injury or, head injury or things that just happened, can dementia be prevented, or can we, or yeah, can dementia be prevented?
So the answer is actually a bit complicated. What we have in medicine is that we can decrease the chances of something happening, decreasing the odds. So there is a genetic component to dementia. So you are born with propensity towards towards getting the diagnosis. You are more likely than somebody who doesn't have the genetic load. Okay. Now, once you have the genes, depends on how heavy the presentation of the genes is. You can do things that can delay, or in some cases may never get the gene to express itself, which means even though you were born with a gene that could give you that disease, your lifestyle kept that gene from expressing, and therefore you never got the disease. So let me give you a parallel, and then I will come to dementia. So I, for example, is born with genetic predisposition to heart disease. So I have X load of genes. Now, X load of gene means that gene makes me more likely to have the disease. Now, my lifestyle, if geared towards good heart health, exercise, weight control, diabetes control, blood pressure control, cholesterol control, stress management, then more likely than not, my disease will be expressed either delayed or never.
Okay.
Okay. So the answer is yes, you can do things that can make it less likely to become a disease for you by certain lifestyle changes. On the other hand, if I'm born with not the X load of cardiac disease genes, but Y, and Y is so big that no matter what I do, it expresses. So genetic load, you and I have no control over what genes you're born with. But what we do have control of is to see what we can do to minimize the probability of gene expression. So let's now talk about dementia. So there is genetic component, but there are several things that everybody can do that can make it more likely that you will not express or you will have delayed express. You see, if somebody develops dementia at 70 and the other person, or with the same genetic load, let's say a brother, develops it at 80, you got 10 years. Okay. And so delaying is not nothing. Delaying the expression of disease is a very, very big benefit. You may not get at 80, you may not just die from natural disease at 80, so you never got dementia. So let me tell you what kind of things can help our brain to stay functional longer, irrespective of what kind of genetic load you have. So number one, prevent the brain from getting injured. The injury can happen in two ways, physical and chemical. The physical injury would be hitting your head. So I saw a movie about a Nigerian doctor here. I saw this movie here in the United States who had developed post-concussion syndrome from playing football. So head injuries. Now there is a talk about head injuries having earlier in life resulting in more brain damage in the late life. So, for example, if you are riding a bike, wear a helmet. Simple thing. So what you're doing is you are preventing physical injury. The chemical injury would be, for example, drugs and alcohol. Right. It's a chemical injury to the brain. All right. So number one, prevent your brain from getting injured. It's an important organ. And the more you keep it from getting injured, the better it is. Right. Then the second thing is anything that is good for your heart is good for your brain. Yeah. Because the brain gets a lot of blood supply. It gets a lot of oxygen. It has to have that to function normally. So anything that clogs the arteries or increase the blood pressure can increase the risk of the same thing that happens to the heart will happen to the brain. So let's break it down. Body weight. You don't want the tummy around the waistline to be too big, because that will become a risk factor for heart disease, and therefore it will be injurious to your brain. Maintaining blood pressure. All right. Then control of blood sugar, control of cholesterol, smoking. All right. Smoking. If smoking is bad for heart, it is bad for your brain. If you combine all those things that are good for your heart, if you do them, they are good for your brain. So we went from injury to heart health equals brain health. Right. General health of your body. So sleep, I just mentioned, extremely important. And the final thing I would say about brain is that brain works on the principle of either use it or lose it. Right. There's a concept called neuroplasticity, which basically means that you can train new things to your brain at any age. There was concept about 50 years ago that you're born with a certain number of neurons, and once you lose them, you never can learn new things, but that's not the case anymore. So continuous stimulation of the brain keeps it more functioning, more viable, which means, for example, as a parallel, if you go to the gym and you exercise, the muscle tone is maintained, you gain muscle bulk, the functionality is maintained. So the same is with the brain. The more you work it, the more neuronal connections will be made and the more functional it will stay. So continuous stimulating the brain. Here is the key thing, not with the things that you're already doing, but with new things. If you continue to just do what you always have done, the brain gets good at that only. It is the new things that the brain has to learn for it to make new neuronal connections and therefore maintain high functioning. So very simple. By the way, that is not just the brain, also the body, because when you learn new reflexes, the brain is learning new neuronal connections. So
Right.
mind-changing exercises, playing chess, for example, crossword puzzle, solving mathematical equations. So I'm going to give you some everyday exercises that people can do.
Okay.
All right.
Good.
You see this phone here?
Mm-hmm.
Is a great
Phone.
equipment, but it is really taking over a lot of things that we used to do with the phone. I mean, with the brain. A lot of the. I used to remember 10 numbers of my children, my family, my siblings. Now my phone remembers them. I don't have to.
You don't have
So
to.
yeah. So one exercise would be that people have start remembering some numbers. So you dial rather than speed dial. Very simple, but it is brain exercise. When you go for grocery shopping, don't write everything. Tend to remember 5 things that you will remember from your brain.
Okay.
Make it 10 later, make it
Mm-hmm.
15 later. Don't rely on technology. Start to make your brain remember those things. When you are
Mm-hmm.
driving in the United States, everybody has GPS. I don't know about other parts of the world, but we don't even now. You just whatever the GPS says, you don't navigate your way around. You don't look for the signs. You don't read the street signs. You don't ask people where to go. So every now and then, give yourself challenge that you're going to go someplace, but you will figure it out.
Okay.
And that's simple.
Yeah, it's good. And we can print out the map like we used to do and try to figure it out instead of just following the blue line or the
Right.
yes.
So it's very simple.
Hmm.
Every now and then, take a different route to your work where you go every day. So you take
That's
I-10, 64, change the routine, find a new way of getting there with your own calculations and finding the way. Great brain exercise.
mm,
Learning new language. New
mm,
language learning is very, very good for your brain because it requires comprehension. Vocabulary, by the way, is a very strong indicator of brain functioning.
mm.
Pick up something that your brain has to learn new in terms of the physical exercise. So if you have never learned swimming, learn swimming because yes, you are moving the arms, but it is the brain that is learning this new skill. A exercise that requires coordination, for example, learning piano.
Right.
One of the things that I think is very good is table tennis because it is quick reflexes.
Quick reflex. Mm,
Right. So play chess. Chess is very challenging for the brain. So
mhm. Yeah.
you don't have to go to any specialized thing. Now, if you do have access, there are certain brain exercise programs on the computer, braingym.com and all those things where the computer learns to challenge you more and more as you get better and better at it.
Mm.
Going
Okay.
back, brain is use it or lose it.
Use it.
Just because grandpa is 75 years old, it should not stop new learning.
Right.
It is
Right.
it is not okay to expect this person to be just sitting there in a chair all day long and then of no brain activity. Um, Families can ask the elderly people to maintain the monthly budget. They have to keep track of what came in, what went down, what is the strategy next month, etc. What is coming in 6 months, a wedding is coming, etc. College funds. So what you're doing is you are enforcing the formula of use it or lose it. So a lot of things can be done in very simple ways. If you
And it's just
combine all the things that I told you, no
uh-huh.
injury, no physical and chemical injury, what is good for your heart is good for your brain, sleep,
Mhm.
nutrition. Now, nutrition is important because your brain requires a lot of good nutrients. A well-balanced diet is what is suggested. But one supplement that keep coming, and you can get from eating fish, is fish oil, omega-3, because that's where the neurons. Yeah, and make sure that people are not deficient in things like B12 and vitamin D and folic acid. Here in the United States, it's not very common to find it. Even though I find vitamin D deficiency in a lot of patients, I find vitamin B12 deficiency, even though this diet is very rich.
Yeah.
But other parts of the world keep in mind that deficiencies of such vitamins can impact the cognition and the mood. By the way, I have actually in my life I have treated more than many people whose depression improved just by giving vitamin D supplement.
Hmm.
Yeah.
Yeah. So,
So
so this vitamins that you just said, is it okay for people to just walk into the store and get them over the counter? Do they need to tell their providers or their physicians about this, or it's something we should just form a habit of using?
I take it, but that doesn't mean everybody should. I do get my vitamins checked once a year. Um, when you get vitamin checked, there is a thing called range. So it will show up what's the number of your blood test, and if it falls in the range. So that is called normal range. The best is to keep it above the normal range so that it is on towards the optimum size. Can this be taken? Well, if you take it, there's a lot of cost attached to that. It is not a replacement of good nutrition.
Mm-hmm.
Good nutrition comes first.
Mm-hmm.
Ideally, one should get the blood tests checked, and if there is deficiency, then you treat it. I cannot say to you go and take vitamins. That's not scientific. What I would say is that make sure that they are not just within normal limits, but a bit towards 50th percentile of the optimum level.
Yeah, okay. And we can just make it a point to take food or anything we're consuming that will be rich in the vitamins that you talked about. That's a
Mhm.
that's a
Yeah,
good
and especially omega-3.
omega-3. Yeah,
Mhm.
that's an important one. Okay, so now we tried to prevent, we could not prevent, and we now have somebody has dementia. What's the treatment?
Yes, so dementia by nature is progressive disease, unless it is 100% vascular, which means a stroke happened, cognition is lost, and
Mhm.
then if the next stroke doesn't happen, then it just remains the same. The problem with the theory is that as you are aging, you are already at increased risk from just having the stroke. So what is the treatment of dementia? Everything that I mentioned to you to prevent dementia or to delay its expression is still applicable even after you're diagnosed,
Okay.
because all of those things that I said we should take care of. If you don't, then the diagnosis of dementia will progress faster. Once the diagnosis is made, you want to delay or slow down the progression.
Mhm.
You want to keep that person as functioning as possible. It is good for the person who has it, but it is also good for all the caretakers. So continue all those things that I mentioned. There are medications that we use. One category of medications called is acetylcholinesterase inhibitor. It's a fancy name for a chemical called acetylcholine. So theory is that in dementia that decreases, these medicines increase that chemical in the brain. So there are medications like Tacrin, Rezidine, Aricept, Exelon that we use. Those medicines have to be started and built up slowly to the maximum dose. Make sure the patient doesn't get side effects, the most common being the GI side effects: nausea, diarrhea, vomiting, loss of appetite. So we start very slow and go up slowly, that those medications supposedly give the brain more acetylcholine. In addition to that, we use another category of medication, which is NMDA receptor, works on those receptors. It's called memantine or Namenda. That's the only one medicine in that category, and that is in ideal situation one medicine from category A, acetylcholinesterase inhibitors, and once the patient has fully tolerated, we add Namenda. It can be first Namenda and then Aricept. But at the end, when both of them are at the optimum dose, then that is the medications you can use. Um, Other studies have been done on high dose of vitamins. There is a food that is FDA approved called Exxon, which is supposed to give ketonic energy to the brain. Um, these medicines are not cure for dementia. There's no cure for dementia. What these medicines are trying to do is to keep the brain functioning as long as it can. It is slowing down the progression. By slowing down the progression, you, the patient, and the family, caretakers, are gaining an enormous advantage because even a couple of years of more functioning is a lot, because taking care of an elderly demented person is not easy. It comes with other complications like falls, for example, psychiatric complications like psychosis, anxiety, insomnia, a lot of agitation. These people get very, very agitated, like a small child in a crib, 6 months old. What do they do? They cry. They move their arms, they move their legs. They are, and just imagine a big body doing the same. So there is a huge ripple effect on the immediate family, the far family. The expense is huge because it comes with a lot of complications. So if you are a caretaker and you have an elderly person, keep in mind this is a real diagnosis. By the way, at 65 years of age, you have 5% chance of developing dementia. At 70, it is 10. At 75, it is more. At 80 or 85, the chances of dementia is 50%, one out of two. And people are living longer. The life expectancy is increasing.
Prison.
So it's a good news that you live long, but you want to be living long and still be functional and have good brain capacity. So um,
I want to ask a question, sir. So I've seen this instances where I have a patient and want to, has been diagnosed with dementia, and we're talking about the treatment plan. And then somebody comes, like a friend or maybe in-law or someone will come and say, "Hey, I used my mom or my dad used that medication, and he or she had side effects. So the other person, this patient that you're working with that haven't even tried the treatment, is saying it doesn't want it based on that. So I want to ask you, so you explain to us and everyone watching that, how, comparable is it that because somebody had a side effect or because of, or, just an opinion that you choose not to treat your loved one for dementia?
so very good question. I'm going to add to your question another comment that I usually get, which is patient is on a medicine on both Namenda and let's say one of the acetylcholinesterase inhibitors, let's say Aricept.
I respect
Somebody, family member comes after 6 months and say, "Doctor, this medicine isn't working." The grandma is still the same.
Mm, yeah.
The grandma is same is the success, because we do not, with any of these medications, expect the brain to gain what it is already lost. The fact that grandma is same means she has not deteriorated. The medicine has worked. All right.
Yeah.
The best that the medicines can do is to continue at the same level when the medicine was started. It still progresses in majority of cases. So number one, you have to educate the family. No news is good news. If grandma is same after 1 year of treatment, you have success. So set up the tone from the get-go. Explain to the family and the patient there is no expectation for it getting better. We want to keep it as close to now as it is going to be. Okay. Number
Right.
two, side effects. Yes, side effects do happen. A smart clinician will use the medicine in a way that the side effects can be minimized. The fact that the side effects happen to some other patient does not mean it will happen to this. Again, the matter of explaining, setting the ground rules. A couple of things I say to the families and I'll do. Um, these medicines, if used on started on a very small dose, let's say Aricept 5 milligrams or Exelon 1.5 milligrams, and you do not increase fast. I take more time in increasing those medications than many other physicians I know.
Right.
The battle is not today, it is 5 years down the road. So you do not want to raise the medicine and lose that option because the patient had side effects. I would rather go slow and get to the maximum dose. The second thing people should do is take it on full stomach.
Right.
That alone helps a lot. The third is that many of these side effects, even though may happen, tend to go away with time.
Hmm.
Okay, so reassurance. Now, the fourth thing that clinicians should do, and to some degree families and patients, is that is there anything else they are doing that can exacerbate the side effects? So, if,
Hmm.
for example, if they're on a medicine that is known to cause GI side effects, let's say diarrhea, and if you add Aricept and diarrhea happens, it is not just Aricept, it is two medicines doing it. So, in practical life, I do not tend to make more than one change at a time.
Time.
Okay, so because you would not know what caused the side effect. The
Right.
important point is to keep your eye on what the patient will look in 1 year, 5 year, 10 years from today. We do not want to rush to start off a heavy dose of medication and lose that option. So educating patients and families, I actually tell them, look, most important organ in your body is your brain. So prioritize it.
Right.
Okay,
Right.
keep it functioning. Otherwise, it's a very scary diagnosis to have, by the way, for the patients and the family. Yeah, it's you need a lot of holding the hand and walking them through this.
Yes. I mean, talking about family now, so let's go into what should family members know when their loved one is diagnosed with dementia? And for those who are already dealing with, who already have a family member or a loved one living with dementia right now, what would you tell them as our clinician?
The first thing that they need to do is to make sure they learn what to expect, what it is, and what to expect, and what can you do to keep the brain of this individual as high functioning as possible for the longest period of time. So all the things that we discussed. There are ways to deal with caregiver burden. So, for example, in the United States, we have Alzheimer's Association where there are volunteers who can support you for any questions, group therapies, even come and help people in their homes. Utilize your resources.
Mhm.
Um, One thing that I would strongly suggest not to is neglect your own health. In taking care of a parent or a grandparent, if you are sacrificing your sleep on everyday basis, it will end up hurting you. If you are not exercising, going to gym because you have to take care of the elderly, it's going to catch up with you at some point in time. So, um, taking care of yourself as a caregiver is extremely important. And of course, you take care of the elderly. If you need, if there's a gap in between, make sure you do use your resources. The example I give to my patients' families is that if you ever travel on airplane, the announcements come when the oxygen level drops, mask will come. It tells you put your mask first and then put it on the child,
Right.
right? There's a message behind it. If you cannot breathe, whatever you're trying to do for the child, if you pass out, the child is going to be without any mask. So taking care of yourself will help you take care of your loved one. And that is also a long-term thing because if you have a 70-year-old with dementia at home, chances are there's long years of care that is required. Um, do not underestimate the power of medications. These medications are helpful.
Right.
Do not underestimate the knowledge that you should have dealing with somebody who has dementia. Uh, a lot of people I've seen in my practice has this understanding or this notion that people can just come out of it. Why don't you use this? You used to do this calculation. Why can't we do this? They can't.
Mm.
So don't get frustrated. Don't get waste your energy on things that are not changeable. So focus on what the science says. Make yourself knowledgeable about those. And it's a challenge, but that's what it takes.
Yeah. Yes, so thank you so much, Dr. Kawaja. I think one more thing I think I should ask because of policymakers, community leaders, religious leaders, those that are in leadership positions and making decisions for more people. What would you tell them to consider in including or supporting or accommodating people who have this diagnosis?
The first thing I will say is that educate people about it. It's not just normal aging. Educate people who are elderly, also the young people who are looking at the elderly, because they are the ones who can say, Grandpa used to maintain checkbook, now he cannot. Grandpa used to be able to find his way in the neighborhood, now he cannot. Educate the community. I think there is a need to educate our primary care physician and internal medicine people because they are the first encounter for many diseases people go to for their annual physical or any other problem.
Mm,
So annual screening would be very good. Yeah. And the leaders in the community can have, once a month, maybe 15 minutes of a TV broadcast or podcast where people talk about this. um, Finding support system for those who already have the disease and caretakers. Like in the United States, we have many organizations like Alzheimer's Association. The support system is actually important. When you are single mother with two kids and have a elderly person who has dementia, you can only think about how important the support system will become,
mm,
and also all the resources. So the community leaders can work towards making that available. um, and then there's a number of things you can encourage people to wear helmets, for example, when they're playing football or riding motorcycles. People can encourage people to minimize the use of alcohol, and educate them the impact of drug use on the brain. Encourage people to go for annual physical where their blood pressure, blood sugar, cholesterol is checked and controlled, which may seems like you are doing it for the heart, but 10 years down the road, this is what you're doing for the brain as well.
yeah.
So educate the
Mhm.
community, make resources available, educate physicians, other healthcare providers, and just spreading this information because it's a big problem. It's like 14, 15 million people in the world that has that.
Right. Right. And the caregiver burden is huge.
It
If we
is.
have 14 million people in the world that has it, that's 14 million family members times so many other family members, and even the economic burden worldwide, globally, it's really huge.
It
So
is.
yeah. So thank you so much for, joining us and giving us all this information. I really do appreciate all the time that you give us, and I every time that I have the opportunity to spend with you, I learn a lot. Thanks
Thank you.
again for being with us, Dr. Kawaja.
Thank you very much.
Yeah, so to
Okay.
everyone watching, I please share this video. And Dr. Kawaja, how can we reach you? If anybody wants to reach you, any organization or somebody wants to reach you regarding dementia, how can they reach you?
So personally, they can write to me on email mkhwaja, like my name, at
Hmm.
msn.com.
Okay.
It's all one word. But I'm sure there's a lot of people in the neighborhood, a lot of good clinicians who have more knowledge than I do. But if there's anything I can do, that'll be the way to do.
Okay. All right. So
Okay.
please share this video so that more people can know about dementia, so that we can help ourselves and also be able to support people who are currently living with dementia or family members of people living with dementia. Thank you so much.
Thank you very much.
And thank you to you. All right, this is the end of it, and I'll see you tomorrow.